speaker, and I'll hand it over to John W.
All right.
My name's John. I'm an addict.
Hey, John.
Had this kind of sprung on me earlier this morning, and ironically enough, I've gone through some health problems here in the past few weeks to a point where I'm actually having to take medication under my doctor's care. In the process of getting that balanced out, I've had periods of time where I'll get dizzy, I'll have hot flashes while I'm trying to get the medication figured out. And when a sponsee of mine asked me this morning if I'd be willing to speak on this topic, I had to tell him no, because I was feeling dizzy and I wasn't sure how I was going to feel this afternoon. Luckily, I took a nap. Have been feeling pretty good ever since. It's hard for me to say no to Narcotics Anonymous, so I was real grateful that I was able to come back to him after lunch and ask him, or before lunch, and ask him if he had someone to speak yet. And I was glad that I had the opportunity. Probably the best advice I can give on the topic of taking medicine or using, suggestion I can give, is to read in times of illness. Our forefathers wrote our literature, and I don't know that I can add anything to what they say other than my own personal experience. I tell the men that I'm close to in the Fellowship of Narcotics Anonymous that you don't have to be a hero. And that's so hard for me to learn, because when I got here, I thought using and the drugs themselves were the problem. And over time, I've learned that it's not the substance, it's why. So I know the difference. If I'm medicating for the purpose of my doctor's orders, this is what you're taking, this is the dose, I know the difference. If I look at it honestly, I can tell the difference. And I know the difference between using for pain and using to hide. There have been times where men will ask me, I'm going to the dentist, I've got to have these 4 wisdom teeth pulled, they would want to put me on this certain substance for pain afterwards. What should I do? Bear it for as long as you can, but don't be a hero. Have someone else help you. Hold on to the medication if they have to. Someone you trust. But don't expect yourself to go through pain, physical pain, at the expense of your spirituality. Because I know that when I'm not in a good physical space, when I'm not in a good mental space, and I'm not in a good emotional space, it's hard for me to be good spiritually. I've got a whole house that I've got to take care of in order to maintain my path to recovery, and physical wellness is one of those. I read something here not too long ago about pain medication and its ability to find the source of pain in your body. And that if you've got a bad back and you take a certain controlled substance to help your bad back, it's going to help your bad back. But if you take it just because it's Tuesday, you're going to get a buzz off it. So knowing the difference and thinking about why I'm doing what I'm doing is important for me. My brother-in-law real recently was in a car accident, broke his back, had a compressed T4, and it was protruding into his spinal column. And he's a recovering addict who's had a real rough time staying clean. And now he's fresh out of the hospital after being on morphine for a couple weeks. The trick for him will be, how bad does he want it? And if he truly wants to get clean again and stay clean again, he's going to have to take certain steps. Just like we had to surrender when we got here, sometimes we have to surrender several times throughout being here. So he'll have to surrender again and give up control of the pain medication that's been given to him by his doctor. I've always been one of those, man, if I've got a headache and the bottle says take 2 every 4 hours, I take 3 every 4 hours. Or 3 every 3 hours. Because for some reason my body needs more than what doctors think. Since I've got clean, I've made a conscious decision, A, to tell my doctor that I'm an addict. And that's most important. If you've got a relationship with your doctor, with your dentist, anybody that has the ability to prescribe medication for you or administer medication for you, they have to know that we are recovering drug addicts. But that's not enough. See, my doctor, when he went to school to become a doctor, out of all the hours that he went to school, he took probably an hour to maybe 2 hours of classes pertaining to drug addiction. So who knows better about drug addiction, him or me? And ultimately, who's responsible for my recovery, him or me? So I got to tell him, and there's still times, you'll go in for whatever, and they want to prescribe stuff, they want to treat the symptoms of what you're going through instead of treating the problem. And we learned in Narcotics Anonymous that doesn't work. We all treated the symptoms for too long and never treated the real problem at hand until we got here. So I've got to tell him, no. Great, you want to prescribe me that. I would rather take the ibuprofen and have a little bit of pain than to take the other substance and be numb to the world. But if I break my back in a car accident and they want to administer morphine to me and I'm in as much pain as I saw my brother-in-law, I am not going to hold my recovery up on this pedestal and say, no, I can't, because I'm a recovering drug addict. I'm also not going to strap myself off. I'm going to let the doctors do their job. Don't be a hero, but be honest. A couple of the guys in the fellowship who are real close to me, who I see on a real regular basis 3 or 4 times a week, they know, because I tell them exactly what medications my doctor is trying out on me, exactly, what I'm going through. Because if I don't keep honest with you guys and keep myself in check, got one more thing and then I'll shut up and turn it over to Jonathan. A good sponsorship brother of mine, and he spoke last night. He had several surgeries, emergency surgeries, was in a lot of pain. When he got done, he was done. He talked about, waking up and not feeling pain anymore and still having this pain medication, and the freedom that came from saying, I don't need to keep this around for a rainy day. I don't need to take some just in case I'm going to feel pain. And he flushed it down the toilet. And the freedom that comes from the fact that, A, he didn't have to reclaim his clean time. He kept his clean time throughout. And once he was to the other side, he was able to do what was right. So I hope that as I journey through, future endeavors in recovery, that I'm able to continue to do what's right. And I appreciate having the chance to share.
Thanks,
That's all I've got.
Thanks, John.
At this time, Jonathan's going to speak.
Good afternoon. My name is Jonathan. I'm an addict.
Hey, John.
I'm awed by the amount of recovery that's here this weekend. I know that I'm going to grow a lot by being here. They say that when you feel like crying, it's because God's touching you, and I think that that's true. I came in and I registered last night, and my sponsor asked me to speak on this subject. Actually, he asked me if I wanted to speak on anything, and I saw this and it was like, whoa, that's something I need to talk on. I'm going to start out by saying one of the same things John said, which is the best information is in the booklet in Times of Illness. Our group has to bring that booklet out about every 2 months and go through the booklet again with someone else who has the same issue. It's often in regard to pain medication. And we have to go through it again. Beyond that, what I have to offer is my experience, strength, and hope. I had many, many, many years of addiction, and in my addiction, in all my usage, in the early 80s, with my addictions running rampant, I was in New Orleans. It was a great place for it. I was diagnosed as having high blood pressure and started on medication there. I was in Boston, running away from my problem in Boston, when I needed some emergency surgery and still in my addiction. And I went in, and the doctors, it was early on, it was 89, and the doctors said that, well, they had to cut me open, and to do that they really wanted to take an HIV test. So I gave them permission to do that. My lover at the time went off on vacation, and I had the surgery, and I went to work, and the nurse called me. This is early on in the crisis. The nurse called me and at work and said that the results are back. I said, well, why don't you send them to my doctor? And she said, well, I really want to tell you what the results are. I said, I really want you to send them to my doctor. And she says, well, I'm going to tell you anyway. You're HIV positive. I was at work at the time, and the pamphlet does go through the feelings that I went through at that time. At the time, that diagnosis was a death warrant. That was in 1989. I went through years of, my lover got ill, and I was his primary care physician for 2 years. And I had always been needle shy, and during the last couple of years, I had to give him shots in his stomach. So I got used to handling a needle. After he passed, I went headlong into a lot of addictions, including workaholism and a few other ones, and then into my drug of choice, which took me down this dark spiral that was spiraling out of control. I gave up on any medication I was on, and at one point knew that I was committing suicide by being actively using. I mean, knew that was the only possible result, was that, okay, I'm going to die, let me just have as much fun as I can on the way out. Something happened, and I got touched, and of course I am a little touched, but I was laying in bed one night in mortal pain from withdrawal, and I was literally in so much pain, my stomach hurt so bad that I thought I was too sick to go to the emergency room. And I asked my higher power for help. And that was the beginning of my first step. Then I got into recovery. And first I got a job at a hospital. I'd done a lot of healthcare work, and I got a job at a hospital. And I was there, and the first thing they did, they want to make sure I'm healthy. So they gave me a physical, and I almost failed the physical. In fact, I kind of failed the physical. I couldn't hold protein in my blood, and it was passing through my urine, and my blood pressure was not reading. It was off the scale. So they started me on blood pressure medication, and I started on one. A month later, they added another one. A month later, they added another one. And they were doing that when I started, I was forwarded to another doctor, and I started on HIV medications. The HIV medications, one of the side effects is to increase your cholesterol level. And so it increased my cholesterol level. And early recovery, not really being clean. This is bizarre. I was not doing my drug of choice, so I thought I was clean. you know. And God said, wake up, you know. And I had a stroke. The plaque had built up on the inside, the arteries in the back of a blood vessel in the back of my neck, and I nearly died. I was in a coma for 10 days, neurosurgical ICU for 17. That's my clean day. The day of my stroke is my clean day. It was November 13th, 1999. I had a lot of thinking to do, 17 days laying in a hospital, totally incapable of doing anything. I couldn't even take a piss by myself. I mean, I was absolutely powerless over anything physical, spiritual, or mental. I came out of that and came right back to the meetings because I needed the meetings so desperately, and I knew how bad I needed the meetings. And as I moved on in recovery, my medication numbers have settled. I now take 17 pills a day. So someone told me the other day, last month, that, you know, life isn't fair. Hear this whining, life isn't fair. Well, you know what? Thank God it isn't fair, because if it were fair, I'd be dead. It truly would be. You know, I came into recovery taking this much medication, and I know the difference between taking medication and using. I know what every single pill does that I take, and I take it exactly as prescribed. I do everything I possibly can to avoid taking any other medication. My doctor, who's a female, knows that I'm an addict. I've actually refused some medication, and she's learned to be very careful in giving me anything at all. She's assigned as little as 3 pills to me. You know, that's it, just 3. I've learned that there's other things besides pain medication which can look as if or be using, and that includes some things that are for sinus medication, and that's when I really have to watch out for. So what I do is I go into John and turn on the shower, and take a steam bath sort of thing to clear my sinuses. And I do that for several days before I'll start on any medication, and then I make sure that the medication is absent certain drugs. I've also met many addicts since I started in recovery who have, and I have to mention a couple other things, still in general terms, but a lot of addicts are diagnosed as bipolar and having anxiety attacks. And you know what? This is my own opinion, but I think all addicts are bipolar and have anxiety attacks. It's like, yeah, so, you know, that's why we're here. That being said, you know, I'm not a trained physician. I have no opinion on outside issues. And medication, healthcare is an outside issue. NA has no opinion on outside issues, and healthcare is an outside issue. I'm not trained to diagnose bipolar or anxiety attacks. And we have people who must take medication in order to survive. They must take medication in order to survive. I have to take medication in order to survive. I don't believe, my estimate when I came into recovery, my estimate was that I probably had 1 year left to live. And I've been in recovery for 2.5 years now. And so I know that it is necessary. I watch every single drug, every single chemical that I put into my body. I'm a little bit more fanatical than some. I realized that I had to give up caffeine. And, you know, everybody wants to drink caffeine, that's fine. I know I can't. Why? Because I go in to a coffee shop and I order 2 triple espressos. It kind of gave me a clue, you know, that I shouldn't be doing caffeine. I know why I'm drinking that. It's not because it just tastes good, you know. I've also limited the amount of meat I eat, and I quit smoking, which I know is an outside issue too. But I have to be very, very careful. The bottom line has to do with what I call, and this is a borrowed term from a religion, but it's kind of the Holy Trinity. It's between me and my sponsor and my higher power. I have to be rigorously honest. I used to hear it called brutally honest, but brutally honest means somebody gets hurt. And it's not brutal honesty I need, it's rigorous honesty. I need to look at what really is the motive for taking the medication. Truly, what's truly the motive. Is it because I think I might hurt sometime in the future, or do I hurt that bad? I know that I have to go that one step further to hurt maybe a little more, or to be in a little more pain with sinus problems or whatever. I have to go that one step further because I'm at risk. My recovery is at risk. Whenever I take medication, I'm putting it at risk, and I have to stay in a good spiritual place in order to take medication. But I do understand there's always a risk in any medication I take. So to do that, I have to be rigorously honest with myself of why I'm taking it. I have to talk to my higher power. And when necessary, I talk to my sponsor. And I don't want to sit here and sound like I was chosen from my higher power, but I have to say that with the unique circumstances that I have a need to carry that forward, to carry that message, to tell other people, to tell other addicts that they can recover when they are on medication. That if they're taking a cocktail, which is what they actually call that kind of medication for HIV, that they can step into recovery. I've also worked with terminally ill, and feel that I could continue to work with terminally ill and stay strong in my recovery. And so this is really important to me, whether taking medication is taking medication or using. And she can take the same amount that he takes at the same day, and she could be using in he not using, because he may need it, and she may be doing it for other reasons. That's truly, we have to be honest, open-minded, and willing, and that honesty is really comes in play here. The other thing I want to say is that after someone has taken medication, regardless of what their take on it is, and their sponsors' take on it is, when they come back into the rooms, we have an obligation to welcome these people with open arms. We're not here to judge them. They made it back in. They have a sincere desire. They have some kind of a desire, and it's not my place to judge the strength of their desire. I am grateful that they made it back into the doors. They may not have. I say this many times, if I ever were to relapse, I don't know if I can make it back. I might have one more relapse in me, but I don't know if I could ever make it back. I'm grateful when I see someone come back in who has either relapsed or has been on medication or been through risky behavior. This is risky behavior, but it is necessary. I agree with John, you can't be a martyr. There's the two different ways that both of which are wrong. One is to never take any medication, which sometimes will lead to a point when your body collapses and you're forced to take it in order to survive. And the other one is to take anything willy-nilly across the counter and not realize that the risks are there. Because your body doesn't know. My body does not understand the difference between medication I'm taking because I have to for medication and medication I'm taking just because I want to get high. And so that risk is there. I am extremely grateful, and I want to thank the committee for asking me to speak today. This was something I needed to talk about, actually. And it's very near and dear to my heart. Very grateful to see all you people here, and I expect to keep growing. Thank you very much.
At this time, we'll open the floor for sharing. I need to remind everyone that you are being taped. If you wish not to be taped, let me know and we can turn the tape off. Always being act. My name's Ed. Like Jonathan, I too am HIV positive because of my active addiction, and I take quite a few more pills than he does a day, but I've gotten it down from almost 70 pills into the 30s, and every time I can take one less pill, I'm doing something right, and it really means a lot to me. It's my goal every year or every 6 months to be taking less pills than I was before. And I've got a doctor on the West Coast, a doctor here in Indiana, one in Texas and one in Florida, because those are the main states I stay in when I travel. And they all correspond with each other whenever I'm in their offices. They fax and talk on phones, so they know exactly what medication I'm on. And I'm highly allergic to aspirin and ibuprofen. It will kill me. If I take one aspirin or any ibuprofen, I will die from it. So it's real hard to medicate me. I've got a really, really bad chemical imbalance. And one of my doctors knew I was an addict just by the way I carried myself. I didn't have to say anything to him, but the first words I say to him is, my name's Ed and my last name. And I need to let you know right now I'm an addict, and I want your version of an addict, because if it's not the same as mine, then I got to find another doctor. Because some of these doctors just love to write your shit up. Excuse my French. Because they get paid to do that. Depending on what drug company just came through there and promised him a trip to Florida, if he can write 100 scripts of this in 1 month, so be it. But, it's real simple for me. If it says take 2, damn, I take 2. If I know if I take more than 2, I'm using. That's how simple it is for me today. And in my early recovery, I would get these heavy-duty narcotics, and one of them was take 6 a day. I might take like 1 a week, and the rest I would sell. Because I knew I knew people wanted them, and in my early recovery, I would sell them. And I didn't need the money. It was just something I did when I was an addict, and it was I just carried it with me into recovery. And but yeah, every day is a challenge for me. Unlike Jonathan, I eat all the meat I can, I drink all the caffeine, and I love to smoke cigarettes, And I can't, sorry about that, but that's just the way it is. And but yeah, I remember early in recovery, after I found out that I was HIV positive, my family had a nurse fly with me wherever I was going, because they knew me. They knew if it said take 1, I'd take 10. They knew who I was, And they knew if I was alone, I'd never get the job done for the family that I was out there doing. And but that took a couple years before I was truly could trust myself. And I tell you, if you can't trust your doctor, then you can't. You got to find another one. And I'm telling you, some of these doctors out there are something else too. And it's funny because since the last time I was up here last year, I've done almost 5 months in the hospital. I got sick quite a bit, and while I'm in the hospital, they got a couple PICC lines in my chest, and that administered some heavy-duty narcotics, and they all know that they have to wean me off of that before they let me out of that hospital. So I don't get out of that hospital with a head full of dope, because my mind doesn't know the difference between prescription and street, and that's very important to them. That they know that they have to wean me off, give me a good 4 or 5 days without any narcotics before I'm let out of that hospital. And that's so important to me because I don't want my clean time to change, But it's real simple for me. Staying clean, I'll stay healthy. If I use, I'll die, without a doubt. And that's all I have from them. Yeah. Open floor. That's why I said it. Hi, Mark.
Hi, my name is Mark. I'm an addict.
Hi, Mark.
I'm going to talk about antidepressants because I've taken those for almost 10 years. I've been almost clean for 11 years. And for me, it wasn't. I'm going to back up here in a minute, but for me, it was a last resort because I didn't want to commit suicide. You know, when I was coming up on a year clean, and then again coming up on about 5 years clean, thinking about suicide a lot, not being able to get out of bed, not being able to make decisions, not being able to brush my teeth, take a shower, not care if I got fired from my job because you know, when it was just a literal struggle to get out of bed and put one foot in front of the other, not wanting to do the things I enjoyed, I had to seek help. And for me, it was a last resort. It wasn't like I'm feeling a little blue and I want a pill to fix it. You know what I'm saying? And I would go back into counseling and investigate any things that might be causing it. Like my man here says, I did a lot of research on it too. You know, when something like that's going to happen, I want to know what it is I'm taking, you know. So let me back it up a little bit. You know, I didn't start using drugs or alcohol till like my senior year of high school, and it was on weekends, and you know, within a year, it's daily use. I didn't go out cold. I was reefer and alcohol for years. And it, you know, for me it was a long progression, and looking back, I honestly felt I had a problem with depression my whole adult life. And I don't know, I can't remember whether I felt depressed before I started getting high, or if that was a result after, or it happened at the same time. But when I came into recovery, I was clean for about 3.5 months, went to a meeting every night. I was on something called the Pink Cloud. I haven't heard a lot of people talk about that in the last number of years, but I felt so good. It was almost, if any of you have ever been on it, it was like it was an unrealistic way to live life, because it was beautiful, whether I was recovering or not, man. It was like I was high on something. And people would say, you know, you're in this pink cloud, and you're gonna, you know, when you come down from it, just hold on, you know. And actually, I had relapsed before I even come down on it, and it took another member to pick me up and take me back to a meeting after I'd been out for about, I can't remember, 3.5 months, you know. And so I came back in. I was severely depressed. I went back into counseling. Started making coffee at a meeting. Went back into counseling, saw my counselor a few times. It was a new counselor. He started with simple things. Well, I used to like to ride my bike. I just don't have the time to do it, you know, like a mountain bike or 10-speed. He'd suggest that I try a few things, like, well, you know, try taking some bike rides and this and that, do some other things you enjoy doing, blah, blah, blah. And I'd see him a week later, and he says, well, how'd it go? And it's like, I didn't do nothing, you know. I got out of bed, middle of the afternoon, went to the bathroom, ate something, went back to bed, you know. And so he made us an appointment with a psychiatrist, which wasn't like the next week. It was a matter of, you know, weeks later. And at that time, I was laid off. I'd gotten to work with a couple of guys in the fellowship that rehabbed houses, and money was tight there after the relapse. I came close to losing my home again, and, you know, the bank calling the car and getting the shit back out of the pawn shop and all that bullshit that goes with using. And I got up out of bed every morning to go to work, you know. And by the time I'd seen the psychiatrist, like about 3 weeks later, I'd pulled myself out of this depression. And even on days where I didn't work, I'd made a stronger effort to get out of bed just to take a walk, just to get going and exercise. For me, I've learned that exercise is wonderful help for feeling blue or depression. Later on, that wasn't enough. So by the time I seen the psychiatrist, you know, I told him how I was doing, this, that, and the other, and he said, well, I don't know what to do. I'll leave it up to you. Do you want an antidepressant or don't you? And I said no, because I don't need it today, you know. And I continued through that winter, focusing a lot on exercise and meetings every day, and it worked. And then about 6 months later, I was taking an intense drafting class. That was the field I was in. I was in a relationship that wasn't working out. There was a few other things going on in my life, and I got severely depressed again. Went back into counseling. This time, after seeing a counselor 3 or 4 times, I still couldn't come out of it. It was severe. I mean, we're talking like maybe I should get locked up so I don't hurt myself. And started taking medication, and it worked, you know. It says in about 2 weeks you'll notice a few symptoms. My worst symptom is dry mouth, and it got me out of bed in the morning. Well, it just did, and it worked for 5 years. And there was a couple periods where I tried to come off of it, and I let my doctor know I want to try to come off of it really slowly, and literally fell apart. And these were times when my life was very good and smooth. There was no stress. One time I was in a relationship that was very good. God was a big part of my life. Lots of meetings, a lot of gratitude, service work, and the medication went away and I fell apart. And for some people, for some forms of depression, yeah, it can be lack of faith, it can be self-pity, it can be a few other things. But you know what? I've met a few doctors in this program that, you know what I'm saying, and we all got opinions. But once again, for me, it was a last resort, and for years I felt I had to justify taking medication, and I just don't feel that way no more. And I read a few books on what depletes serotonin up here for me, and the biggest thing is stress. And we were talking with a few other people. Most of the health problems in the world today are stress related, and if you can get rid of the stress, it'll keep your immune system up and other bodily things that will just keep you healthy, you know. So about 5 years ago, the Prozac quit working, and it's a long story. I had to go through different doctors. I went to the hospital to get admitted. They said because I wasn't openly admitting that I was thinking about suicide, they wouldn't admit me, but I did get a new prescription for another antidepressant. 2 weeks later, I'm getting out of bed in the morning. And just recently, I tried to come off of it, and really much slower as far as weaning myself off of it. And the early signs were coming in very sluggish, wanting to sleep more, cloudier thinking, and so I went back and started increasing it. And there was about a week there I was mildly depressed. And you know, if you got to take something, do some research. Just don't, you know, just don't leave it up to the doctor to prescribe you something. You know what I'm saying? I mean, go to the library, get on the internet or something. And I've learned that sugar substitutes like your aspartames deplete serotonin. Stress was a big one, and I put it together the last time that my old medication quit working. There was 3 or 4 major areas of my life that were very stressful, and one was a relationship. And to have this person tell me that I don't need it from Jump Street and shit like that, and just criticizing everything I do, I feel blessed that I'm no longer with this person. So, you know, still today, sometimes I feel I got to justify why I take it to other people, and I'm still getting through that. But for me, it was never a matter of running out to find something to take to fix it. It was a last resort, you know. Even pain medication, I've been very fortunate that I don't have to take that, but I read a lot about health issues, and I still smoke. I mean, every other area of my life, I do things pretty damn healthy. except when it comes to when I binge on chocolate and smoking. You know. And all the others, you know, I eat lots of fruits and vegetables, I take my vitamins, you know, I try to get some form of exercise, but fuck that smoking. And when I start on chocolate, I can't stop. I've gotten better to where I don't actually get sick from eating too much of it, you know. I'll put some of it in the refrigerator and finish it off the next night. And I go through phases of craving chocolate and not. But as far as people who have to take pain medication, there are pain relief clinics out there. You know, there's a lot of different things. And it depends on how severe. We just got to be careful as addicts because our own minds can fabricate more pain than what's really there. And I'm the last person to tell somebody what you need to take for your pain, because I'm not walking in your shoes. You know, I can't tell you nothing about that. But do investigate other healthy choices before you know, take something that could, you know, kill you. So that's all I got. Thank you. Pick somebody, Ed.
I don't have to.
My family, my name's Bob. I'm a grateful recovering addict.
Hey, Bob.
Sometimes.
Oh, come on, most of the time.
And they call me Dr. Bob because I'm in the medical field also. And it's a club name I brought with me into the fellowship because I worked in the hospital for 20 years before. But that's all irrelevant because when I got clean, you know, I have a lot of friends who are physicians, and I have to agree with everyone that spoke up here. They don't have a clue about addiction. I went to one of them, who was a dear friend of mine, who I saved his life when we were fishing one time. I told him I wanted to get clean. He said, "Here, take this. This will help." I swear on my kid's life. I said, "You don't understand. I don't want to take this. I want to stop taking this." And he didn't have a concept about what I was talking about. No clue. And he's young, a Notre Dame graduate, tops in the class in his residency, largest internal medicine practice on the east side of Detroit, and not a clue about addiction. I'm not going to sit up here and babble about it. What I'm going to say is, at least he's open-minded enough that today he has seen the changes in my life through the fellowship and has gone so far as to call me to ask if it would be okay to give my telephone number to some of his patients, which in my book is a flippin' miracle. Because the difference between God and a doctor is God doesn't think he's a doctor. You know? Most doctors think they're God. You know, having worked with him all my life, you talk about ego, whew, man. At least he was open-minded enough to see that there's an alternative and that pills don't fix everything. You know what I mean? And you know, I'm grateful that he has learned and that he is willing to try something different, even though, like someone said, it might cost him a trip to Florida, because it's true. You know, whoever's spending, it was you, Ed, that said that.
Yeah.
Whoever's spending the most money that month on their pharmaceutical reps is what's going to get prescribed that month. You can have two identical drugs that are supposed to treat the same symptoms, and whoever happens to be the favorite rep that month is the one that gets written for. And it's a vicious cycle. And unfortunately, I'm right in the middle of it because I own a medical supply company, but you know what? I don't send them to Florida. I'm grateful that we have a place that we can come to and sit here and share about these problems that those people out there don't have a clue what we're talking about. Not a clue. You can talk to your aunts and uncles and family, and it's just don't take anymore. Stop what you're doing. Well, if I could do that, you know, I wouldn't need to be here. Thank you.
Thanks, Bob. Hey, Mark, in the back, come on up.
Thanks for your willingness,
Thanks, Ed, I guess. Another one that told me to keep coming back, man. I'm an addict. My name's Mark.
Hey, Mark.
I guess I'm gonna talk about what I just went through about a week ago. I got into a dentist thing, man, and this is how I know some of this recovery thing is starting to wear off on me, because when people talk about, man, I had to go to the doctor, I had to go to the dentist, my concern now is, how are you doing? Where in the past it was, wow, man, what'd they give you? You know, because if you got some spares, man, I'll help you deal with it. You know, so I don't think like that. So some of this changing is starting to occur in me. But I go to the dentist because I don't know what it's. Oh, root canal. Yeah, I got this thing he calls a hot tooth. He's educated, I'm not. I know it hurts like hell. And he knows I'm an addict. He's my dentist. And I believe it's been talked about here, please, the pamphlet, In Times of Illness. We get all our information out on the street, man. That's what we know. And everything I know, just like the book says, it's subject to revision, especially what I know about the truth. So if I need help, I need to go to the people that love me, that can give me the help that I need. I can't put this blind faith in the doctors, man, because I got this attitude about them. So that being said, I mean, I inform my physician that I'm an addict. I got my little book now, you know, my little daily calendar and shit with all my phone numbers, and at the front page has my doctor, my cardiologist, my dentist, you know. That's how my life is changing. I go in there, and he didn't even ask me if I wanted anything for pain. He said, look, I can't schedule you in for a couple weeks, so I'm going to go in here, I'm going to do this drilling around, I'm going to recap, and I'll holler at you later. And I said, okay, cool. Because I'm thinking, man, I'm going to Camp Mac, you know, I don't want to be taking Tylenol 3s and shit, you know. I mean, I'm already into the future, you know. So I didn't take nothing, and that night, I'm in bed, and I woke up, I don't know, about 9:30 at night, because the night before I was up all night with this damn tooth. So when I went to work and I got out home from the dentist, I went to bed early, but I woke up about 8:30 and I was in pain. And Debbie got me a couple of aspirins, and man, I started pacing, and I started rocking, and I started getting fetal. And I'm all the time thinking, okay, this is maybe one of them times where maybe some pain med would be good, you know? And she's like, dude, I can't help you no more. Don't be a martyr. And that's what, you know, wow, yeah, I'm being a martyr. Mm-hmm. So I got my ass into the hospital. Now it's a 20-mile ride from my house to the hospital. She don't drive. Thank God I went alone, you know. I didn't have to deal with Debbie at the time, because then I could stay in my shit, you know. And so I'm driving down the road, man, and I'm thinking, whew, man, I'm in pain. I know he's going to give me Demerol, man. You know, I'm going to get some Demerol. You know, and I'm driving down the road, man, thinking about the damn Demerol. And I get into the hospital, and I walk into the emergency room, and it's about, I don't know, 10:30, 11 o'clock at night, you know, and I mean, I got a leather on, my shit's looking like I look, and I'm sitting there like this, you know, and I'm thinking, now, there ain't nothing I can tell these people. They already made up their minds, man. Here's another dope fiend, you know. So I get my little thing done, and I go into triage, and the RN, I love her, man. I love the nurses. If there's any RNs in here, please. You people are beautiful, man. She said, why didn't you ask for something for pain? I said, baby, I'm in recovery, man, and that shit scares me. And she understood that right away, and she hit me with the blood pressure thing. She said, man, my shit was off the wall, and she put me in the room, and I'm sitting there waiting, man. I'm rocking, and down the hall they're talking about Demerol. I'm going, wow, man, my higher power is working. They're talking about Demerol
I'm gonna give me some. And my man come in and he says, "What's wrong?" I said, and he said, "All I can do is numb you and give you a Motrin." And I said, "Oh God, thank you. Please get me out of the pain, man." And that's all he did. He numbed me. He gave me a Motrin and sent my happy ass home. I didn't get no damn Demerol. I didn't use, but I took it too far, you know? I took it too far. But for me, I don't know what too far is, you know? I don't know I'm a dope fiend, man. I will tell my dentist, okay, you're going to cut this shit out, you know, but God damn, I might hurt later. Hook me up a couple Vicodin just in case. You know, I don't know. So for me, I got to take it too far. That's what I got to do. I don't know what you got to do. But please, whatever you do, get with somebody in this program, man. Don't trust the damn doctors. We were talking about it a little earlier about the bipolar thing, man. The treatment people come and they go, "Man, now I'm bipolar." I go, "Shit, so am I, man. If I'm getting dope, I feel good. If I don't, I feel bad, you know? I mean, that's how I am, but I'm not a doctor. If you're bipolar, you better do something." I got a daughter that's bipolar, man, and she takes the lithium, and it keeps her pretty chilled, you know? But I came to this workshop because we're an aging fellowship, man. We have these issues. There are people that have been instrumental in writing our books that are I've been with them, man, and they died of cancer and they had to do morphine drips, man. You know, and these are people that died clean. They took the shit as prescribed. I too, when it says take 2 every 4 hours, I get dyslexic, man. I take 4 every 2 hours. You know, I'll call you in the morning maybe if I forget that, you know, I mean, that's what I do. So I never been one to follow direction. But see, when I came here and I begged you to please help me, you gave me some direction. You gave me 103 pages that give me life today. And I try to practice that shit in the rest of my life. So when I get a pill bottle today, I look at what it says, and I follow that to the T, man. That's what I do. And I don't know, I ain't got nothing more to say about this shit, man.
Yeah, you back there yawning. Come up here and share for us. Come on up.
Yeah, I was just joking about picking somebody.
Sorry, buddy.
Hey, it works. A higher power working through you.
Hi, my name's Steve. I'm a recovering addict.
Hey, Steve.
And this is an appropriate topic for me. I had all kinds of shit going on last year. And actually, I'm real close to. I enjoyed listening to Mark. Mm-hmm. Yeah, I'm taking it too far right now. I had a car accident about 4 months ago, and I have a herniated disc in my neck. And I wanted to come here and be clean. And I'm fucking hurting. And I didn't bring anything with me either. And I think I pushed it a little too far, but I'm going to get away from that for right now. I heard I was at a meeting back in the islands where I got clean, and I heard this guy say something once. He had Hep C real bad, and I have Hep C pretty bad. I have to start the treatment for the 3rd time. Tuesday I have to start. It's on this waiting list for a long time, and I'll tell you, this Hep C meds suck. I mean, there's 2 side effects. One is rage and the other is depression. And actually the 3rd now is insomnia, can't sleep. And it's madness. And but my wife and my kids, everybody's all geared for it. And they know it's coming. Because I don't have liver damage yet. And that's a really good thing. Because now I have a chance to heal it. And this PEG Intron's supposed to do it. But I just real flat out, I'm scared. And you know, I heard it said once. I was in a Big Island at a gathering there in Hawaii. This guy said something to his sponsor. He goes, "I'm sick, man. I got this Hep C. And the sponsor looked at him and said, "You're not sick, you're in fear. And your fear is attacking the weakest part of your body."
Mm.
And I thought that was just very interesting. And this thing about stress is really important. You know what they say to do with Hep C is eat right, exercise, and reduce stress in your life. And I was like, Jesus, sounds like anybody should do that. But I came, you know, my childhood, I was one of those undiagnosed ADDs. You know, I was a troublemaker. I was in trouble with the law. I was all fucked up right from the beginning. And undiagnosed, and when I found the drugs, you know, I was just medicating myself right into, you know, right into these doors. And I went through the depression thing too. I know some people definitely have chemical imbalances, and it's like necessary. But I'll tell you what, I had depression too. But a lot of it had to do with my traumatic childhood too. Because if you don't do your work here, that shit is gonna kill you. And it will come up in a variety of undefined neurotic behaviors. And what'll come up is, you know, I call it the art of creative diversion. You will find some way to avoid feeling how you really feel, and it will lead you right out this door. It will keep you from any intimate, fulfilling relationship. It will keep you from friendship. It will keep you from anything, and keep you moving and running until you finally take a stand somewhere and deal with the shit. And it's not an easy thing to deal with, but I was so angry and so unwilling to express it, because then I was going to be like the people who beat the living shit out of me. And I had to take a time and space and dedicate it to myself, to heal myself, to go in and just let that, you know, part of me speak about what had been done to me. And that was like me taking my antidepressants. I'll tell you what, that cut me loose. And I have been free from that point on. And so yes, there are definitely people who need to take medication, and there are definitely people who better do their work. You know, my suggestion is do your work. If you're feeling like you're going to hurt yourself, by all means, get some help. You know, I'm not a doctor. I'm in no way would prescribe anything for anybody. I just know what worked for me. But I know if you do have some kind of traumatic childhood or some kind of serious unresolved traumatic shit that happened in your life, you better investigate resolving some of that. Anyway, well, you fucked me all up, man. I didn't want to talk about this. I'm real emotional about what I've done to myself this weekend. I got rear-ended. I was at a full stop and somebody plowed into me going about 35 miles an hour. And you know, they told me after I got out of the emergency room, they said you'll be fine in about 4 or 5 days. And that was January 25th. And they kept telling me there was nothing wrong with me. And I'm going, you know, there's nerve, you know, I'm a licensed massage therapist. I know physiology and anatomy, and I know the brachial nerve plexus is all fucked up, because I'm going, pains going down my arms and all this stuff. And I'm telling them, and nobody's listening, and the insurance company didn't want to pay for an MRI. And finally, I went to another doctor, and they took one, and sure enough, I have a herniated disc between C6 and 7. And and I've been having to take this Vicaprofen. I told them I didn't want this strong stuff, and they said Vicaprofen's a new one. It's an anti-inflammatory mix. It's probably the same thing as codeine and Tylenol. I don't even know, because I've been trying to stay away from it. But I have to take it. And what happened is, about a week ago, I wanted to be real clear, because I'm coming here to share, and I didn't want to take it. And so I eased myself right off of it, and just dosed up with Advil. You know, I've been doing that, overlapping every day. And I'm fine till I wake up. See, what happens is every time I go to bed, I wake up and I'm one of those tossers and turners, and I tweak my neck every day. So this has been really a good meeting for me, listening to all you folks share. And I particularly enjoy what you had to say, because some doctors really do think they're mighty God,
Mm-hmm.
you know, and they're actually very ignorant and very afraid that they are, you know. And So I'm glad you're all here. Thanks for asking me to come up here.
Hey, Pam?
Oh, yeah, really. I've had
Hi, Pam.
medication in recovery. I don't know. Like the last guy, I got in a car wreck with about 11 years clean, and I got hurt pretty bad. And they were telling me they didn't know what was wrong with me and sending me for all these tests. And in the meantime, take this pain medication. And I was in pretty bad shape. It was real hard to even get out of bed. On a good day, I could sit in the lazy boy all day. And so I stopped going to meetings. I couldn't come and sit in those hard chairs at the meeting. Couldn't sit in the car. And I was all right, I was taking the medication as prescribed. And eventually, it just wasn't working good enough, Eventually, they couldn't fix me. I kept going to doctors. I was in physical therapy. And it just wasn't getting a whole heck of a lot better. And it still hurt too much to go sit at a meeting. So and two started to seem like they were working a little bit better than one, and I, at about 12 years clean, I ended up relapsing on the pain pills, and I stayed out there for about 2.5 years on them. I can realize today that there was a lot of other issues going on, but one thing I want to say about the pain medication is that even taking them as prescribed, it kind of sucks the God out of your life. You just kind of don't quite need it as much. For me, I didn't feel high. I just didn't feel. It was enough to make me not feel. I had been clean for quite a few years. It worked. I didn't have to feel. And I liked it, I liked that feeling. I liked having that break. And it was also safe and clean. I could go into the nice doctor's office with my insurance card because, I had been clean. I have insurance. And walk into a nice drugstore and with my copay, and it was all real easy. I wasn't out there on the street, and I never did during my whole relapse. I never did use street drugs. I never drank. It was all just the pills, But 12 Vicodins and 6 Somas will do it, But it was enough to make me not think straight enough for long enough to where I thought I could do that, and I was able to rationalize not going to meetings anymore, knowing what I know today. I'd crawl in there on my hands and knees and lay on the floor if I knew what I was, setting myself up for. But you guys are talking about don't be a hero. Well, I thought I was just taking care of myself, at first. What I come to realize since I came back and I got about a year clean now, is that it really all had to do with a lot of my 4-step stuff. Stuff that I thought I had dealt with and really didn't fully. And And what that car accident did was bring up a lot of these issues that weren't resolved in my life. I think the last guy was even talking about that same stuff, you know. It's like, you don't know what you're gonna be thrown in life, you know. And today I better have enough meetings under my belt to be able to handle it, you know. I better have, and all I got is the meeting I went through today, you know. If I ain't stocked up on my recovery, if I ever get to thinking I'm good enough today, you know, you know, no thanks, I don't need a meeting today, I'm good, you know. You know, my life's good today, 'cause I go to a meeting every day. You know, I could just about recite that book backwards and forwards. I've been around this program 17 years. But, you know, I don't know. I don't ever want to have that feeling again of not needing a higher power, or of not needing these meetings. I don't know, I guess that's all I got. Thanks.
Thanks, Pam. Anyone else in the last closing? All right, Scotty.
Scott, and I'm an addict.
Hey, Scotty.
I wanted to come in here for this workshop because I've had a couple of experiences in the last 18 months where I've had some surgery. Way back in my years of active using, it was real easy to go to the doctor, you know, and play them for the back hurts, and the neck hurts, get the Vicodins or whatever, and not even read the damn thing, just take them as I saw fit. And when I got clean in '98, since I've been clean, I've never taken a pain pill or any form of pain medication other than a Motrin or an aspirin or Tylenol, with the exception of 2 times. 2000 in March I had elbow surgery, and then this year in February I had knee surgery. And both times it's like every doctor, every nurse, and anesthesiologist that I can stop prior to having anything done, it's like, you know I'm an addict. You know I'm an addict. And you get tired of telling the story over and over to them, but I realize today how important it is that they understand that I'm an addict. I also don't like to be in pain, and I don't have a problem with them giving me morphine if I need the morphine. I don't have a problem with them writing me a prescription for Vicodin if that's what it's going to take to keep me from being a martyr, from being a hero. I got friends in the program. My buddy Mark delivered me to the hospital and delivered me home both times. You know, and for a couple of days, I followed the damn prescription. If it says 2 every 4 to 6 hours, it was 2 every 4 to 6 hours. And when it got to the point where 2 Motrin would work every 4 to 6 hours instead of 2 Vicodin, I got rid of the Vicodin. And the committee in the back of my head's going, you might want to save those, you might need them. You know? You might need them. Now, hell, if I need them and I need them that bad, I can take my ass back to the doctor. You know, I mean, I got an insurance card. You know, I can. If I need to go back, I can go back. But I don't have to play those games with myself. I blew C6, C7 out in 1991, and it's still blown out. And over the years, I've gotten used to dealing with good days and bad days. And if Motrin doesn't fix it, oh well. And so far I haven't been debilitated by that. But I do have some bad days, man, and I know where you're coming from. I know where you're coming from. It's really all that I had to share on this. You know, it's nice to be in recovery and have a support structure and the fellowship to help you deal with issues of surgery. We get clean and we have to start taking care of our health. You know, things that we tore up all the years out there and ignored. You know, now they hurt and we have to do something about it. You know, the only thing that I take prescription-wise on a regular basis is an antihistamine, a steroid, and a blood pressure pill. And I kicked and screamed for 2 years before I agreed to let them give me the blood pressure pill. It's a pride thing, you know. But that's all I got.
Thanks, Scott. Well, nice way of closing with a group hug and a prayer.